Dr. Padma, thank you so much for joining us on BW Healthcare World. When we're talking of multiple sclerosis, let's begin with trying and understand what exactly is multiple sclerosis. What do we mean by that?
So, multiple sclerosis essentially is a disorder of the nervous system, which is called a demyelinating disorder. Essentially, if you look at it, there are these cells, nerve cells, and they have their tails called, they have the axons and all which goes on, and they're coverings on that, which sort of protect, help in the navigation, help in the propulsion of the impulses or the energy for our thoughts to transform into actions.
Right.
So very simply put in, and this covering gets destroyed. So that's called demyelination. So myelin is the thing and it's getting destroyed.
Right.
And it's getting destroyed by mechanism which is called autoimmunity. So we are reacting to our own cells.
Right.
And this process could be triggered by an umpteen number of mechanisms. A lot of it has been unraveled. Lot of it needs to be unraveled. So it's a kind of a mystery box to find the right treatment for the right patient. However, said that, a lot of advances have taken place. The uniqueness of this disease is it's striking the young. So it is striking someone who's completely unaware of that something drastic is going to happen to them in their life. So they are not, aged or hypertensive, diabetic. There are issues, and you know that there are something comorbid conditions happening in the body. These are young people getting into the college, have finished college, getting into their jobs, finding a life partner, getting into that, those major and exciting challenges in life, marriages, pregnancy, childbirth, career graphs. That's when it strikes.
And
That's the reason it's unique. In the sense, the implications are humongous.
Got it. But you said that it's at a young age that people are discovering that they have this issue, this concern. What are the early symptoms? Because at that age, usually people are unaware of what is happening in their body. They do not respond unless it is very, very drastic and it is impacting their day-to-day life. What are the early symptoms that anyone should be taking care of or looking out for and be alarmed that, okay, listen, let me just go to the doctor, at least show and get myself checked?
There is excellent question. So that is true that a lot of times people will not know. And it's not just once awareness, it's also sometimes, when you go with these complaints to, a practitioner, maybe even they may not be able to get a hold of, this could be this, because they could be transient, they could be mild, they could be non-specific. So the spectrum will start off with being extremely mild symptomatology that something is amiss and transient, to being extremely major, so that they would then rush. So let me give you an example. So classically, multiple sclerosis could be divided into several varieties. The one which is most commonly seen is called as RRMS, or relapsing. So the recurrent relapsing, variety, wherein a person, say a 20-year-old, has a sudden, say, a vision which seems blurred. So they would rub the eyes, seems very blurred. It could be pain. A lot of times there is pain, sometimes there may not be pain. And maybe over the next couple of days, it sort of resolves. A lot of times, because there's a vision loss, people would go for a checkup. And they would be seen, maybe they are at a remote place, wherein it has a self-resolving tendency to. May not always resolve, but it has. If it resolves, then you tend to ignore it. But more importantly, if there is a little numbness in one area, and you would say, oh, maybe I've slept over it. Maybe it is true. And then it resolves. You won't forget about it. There's a little disbalance in walking. Then it's gone off. There's a problem in urine control. You're going more frequently. Maybe it is urinary tract infection. Maybe not. You have some kind of a band-like sensation over the trunk, and then it is gone. Just today in the outpatient, I saw a lady who came and said that she had this kind of a band sensation in the trunk. Sort of, she thought maybe I've slept over it, maybe there is something, some insect bite, and she didn't find anything, and then it resolved. And then later she found numbness in the feet, which again, it was thought that maybe there is a B12 deficiency. You get, usual executive checkups, and it was low. So she's taken it, didn't resolve. Then after a while, it went away. ignored, and then after a month she got more paresthesias and this time developed a weakness in walking. That's when she came and we found plaques. So symptoms could be mild, could be evanescent, could be transient. So the it cannot be that every time you find something amiss you're rushing. But then if things are such that there are vision loss, there's an imbalance, there's a urinary retention which again resolves, there is any problem in walking which may resolve, these kind of a major deficits which may resolve over a period of time, don't ignore them and come, and don't think that I have been to gym, I have overexerted, it's my B12 deficiency, it's my thyroid problem. Don't self assume that this is wrong, and this happens, thanks to a lot of information which is again available. Thing is, I mean, I'm going beyond your question,
No,
is because you see the other thing which is sort of unique in this disease is that it somehow strikes people who are educated and at a strata who are aware. So you have access to information which is available to you through media, through the through whatever the general thing with your
Absolutely.
smartphone.
Absolutely.
So they read about it and they would also self-diagnose. The other thing is they are educated enough to try and comprehend and analyze. In that analysis, you also have a very aware and educated population. You will also have a aware, educated, but self-medicating and self-assuming and self-concluding population too.
Absolutely.
So you would have some kind of one that you don't want to believe that disease. You will get very concerned and very alarmed at the disease. So the reactions will be different, or you will get into an overdrive, or you will find, say, oh, the medications have so many side effects, so let me find something else. And so I think this is one disease. It's not like a child with a problem, parents go and treat. It is not like an elderly person, okay, hypertension, diabetes, there is stroke, there's heart attack, cancer, so you have this. This is a very unique thing. And that's the reason we need more awareness, I think, not just amongst public, but across the strata of even healthcare as such.
Dr. Padma, when I listened to you and when you told me about the symptoms that are there, and they typically have a symptom which is an overlap with something else, and which is why you don't really take it too seriously, or this does not come into your mind that you could be having an MS. Uh, on the contrary, on the other side of the spectrum is when somebody takes it really seriously. How do we stop people from becoming paranoid by reading? Because what is happening is a lot of people are going on to Google. They don't go to the doctor first, they go on to Google and they put in their symptoms, and then they get really paranoid for the spectrum of diseases that are shown there which have similar symptoms. How do we create kind of differentiate between the two, that okay, this is when you need to be alarmed along with this combination of symptoms, or if it is there, this thing is there, then go and meet someone generally, or it's nothing to be alarmed. How do we differentiate?
What is it? All said and done, don't be alarmed. You see, the thing
And
is,
sorry, another part of the question extension is that if you don't take it seriously, you ignore it. Like you said, most educated people will go and say that, okay, listen, if I'm going to urinate too often, it could be diabetes, right? From the time you have your symptom to when you start taking it seriously, is it too late?
so one, the adage is it's never too late to treat MS. One. Second is what you're talking about is called as a treatment gap.
Right.
So the treatment gap could be because, sure, there's a lack of awareness, there's lack of infrastructure to be able to diagnose that situation, and also maybe the accessibility, availability, and affordability to, there are several aspects to that. So alarm doesn't help. However, what I mean to say is that the crux of multiple sclerosis treatment is getting the right drug to the right patient at the right time. So in MS is extremely heterogeneous. Unlike other diseases, there is a set pattern of symptoms, set pattern of signs, and a set pattern of management. MS is completely heterogeneous in its presentation, in its pathophysiology, as to what's causing it in that individual, what is the most common mechanism of autoimmunity in that individual, what has been the trigger, and also what would be the best medicine. And one medicine is not going to be there across the whole life. There are levels. There's a level 1, 2, 3, 4. You need to know when to switch, when to graduate, when to tone down in your life. When there is a pregnancy, do I need to get off lactation? I get off, when do I start? The whole process here is to not to have attacks and not to increase the disability. They're the two main things. And then now you have a lot of biomarkers, whether it is MRI, whether it is other varieties, biochemical, and this science is expanding tremendously. Said that, we don't have to just say that, oh, I don't have an access to everything, therefore I can't do anything. That's not true. With whatever resources you have, you do have some adaptation of what is available. We have a lot of jugaad systems,
Yes.
isn't it? And in low resource countries, when you have infrastructure which is low, we have to find some answers. We can do that, but then just remember, for the person who's been, say, diagnosed with MS, is to come to the MS treating doctor and stick to that plan. And if there is an issue, come back and proceed with what is, it has to be an informed dialogue between the person, the caregiver, and the doctor.
Wow.
Don't take independent decisions. If there are concerns, come back. And even for a physician, it won't be a thrust down. It has to be an informed and a combined to and fro dialogue, and that's the reason we have MS clinics.
Yeah.
The uniqueness of this thing is that we need to give time. Time is the most important thing in trying to understand is these young people will need to deal with life situations along with this disease, and we need to hold their hands and go along. So there is hope everywhere.
So, Dr. Padma, you were talking about the right treatment for the right body, right symptoms, etc. We are going towards personalized medication. Uh, Genomics is there, AI is there. How has the treatment for MS evolved over the period of time, and what are the treatment options which are available today, and how does one choose
Which one is
which
what?
one for whom?
So-
Wrong question.
So before 1993, we had nothing.
Okay.
And then came interferons, and then we have glataramar, these are level ones. Then we have oral drugs, and then we had some magic bullet, which is natalizumab. And then the monoclonal antibodies started coming in. And when you have to look at this tapestry and look at how the entire ecosystem of managing MS has grown, nothing before 93 to the whole landscape is completely flooded with opportunities now here. So that's where I said this level 1, 2, 3, 4 is how we have management of starting level 1 when you have relatively milder severity, to starting off in what is called as an induction. So you start off high potency medications when the disease, and there are now biomarkers to the cohort to define who are the people that the moment they start, they're going to go very severe and accrue the disability very soon. Two, how to escalate, when do you switch? And there is also new concepts, what is called as PIRA, where there's progression of disability is independent of relapse activity. We are understanding how the disease progresses. It is not just inflammation. There is a degeneration which may take in. So you prevent the degeneration, and now, in fact, there's a whole lot of emphasis on how to actually get back the function, how to remyelinate, how to get back a lost function and decrease the disability, so you have a restorative part also. So it's an exciting time to be in, at least here with this armamentarium of for multiple sclerosis being in form of a number of strategies, very, very, stratified. What I would say is focused thing to a particular thing to a broader immune modulation. So again, precision medicine is personalized. Therein comes the genomics, and which is the flip side of that are, of course, that it's still evolving. And there are certain biomarkers which are biochemical, which like NFL, which is not freely available, may come later. But again, I'm coming back to same things. Let's not look at this way that, oh, I don't have access to all of that. No, with whatever access I have now, we can still make that difference.
Right.
So yes, what you said is true. That is really, really vastly and fast expanding scenario of understanding disease and thereby managing a person living with MS.
And are we at a point where we can say that MS can be cured?
So you see, when you talk about cured, now tell me one disease which is cured in the body, which is apart from infection. Name anything.
Yep.
Tell me.
I can't think of.
So they're all controlled.
Right.
So, when you talk of a cure, it's something which is infection.
Right.
Like, but most of things, when you say the cancer is cured, is great. Cancer goes into remission and you're living your, the lifespan increases, which is true. There are certain diseases, including some cancers, which are cured. So therefore, we are also optimistic that this disease also may find the cure. Now, the cure basically is get rid of whatever is actively happening and recoup whatever lost function is back.
Got it.
So, that part of it is definitely being tried. I'm hopeful in my lifetime I can see that, but even if it doesn't happen, but there is hope that it will happen. We'll live by hope, don't we? Yeah. No,
My
stop.
last question. I have a last question because this stemmed from what you spoke about, the lifestyle challenges. What are the lifestyle challenges that a young person with MS could be facing, and what is it that you recommend to them apart from the medication?
I would certainly definitely say don't smoke, don't take alcohol.
Okay.
I mean that's a no-brainer,
Right.
common sense. But I think there is a whole lot beyond a physical disability here. There's a whole mental health issue, cognition, and functional incapacity because of the mental health issues which could be inherent because of MS, because of certain medications, because of the social and societal attitudes, and because of the fact that they have suddenly been, they have to the apprehensions of having been diagnosed with disease. So this whole spectrum leads to mental health attitude and the personality and cognitive changes you can actually make out. And in the combined disability assessment, we not only have physical, we not only have other aspects like DDSS and others, we also take in the cognitive function, and that is being now looked into very seriously. So the psychological, hand holding, assessment, as well as training and therapy comes into. So when you're managing MS, it's not only medication and a doctor. You also have an occupational therapist, you have a physiotherapist, you have a urologist, you have a psychologist, you have a psychiatrist, and various other inputs according to what is the functional incapacity of that particular individual. So it is a team effort, and that's the reason why MS clinics are also important to be, in that. So I would think that, in a management of a person, it's important to comprehend what is it that is mostly impacting the life of that individual. So in a lifestyle, they need to stay positive, optimistic, be physically active, and adhere to the medication or a regime. Their concerns, get back to the doctor and address them, and don't self-medicate, and so just don't stop and then give up. Don't do that. So that part of it, I think, over a period of time should make a difference.
Absolutely. I think what I've heard is that it's a holistic care that needs to be provided to somebody who's dealing with MS. Dr. Padma, thank you so much for speaking to us. And
Thank you.